Hi, my name is Olivia Lewis. Today we're going to be talking about aquatic programs for the arthritic elderly. So what is arthritis? Arthritis is a disease causing inflammation of one or more joints of the body. The two main types are osteoarthritis, which is breakdown of cartilage between two joints, causing the joints to rub together over time. And the other main type is rheumatoid arthritis, which is an autoimmune disorder where the immune system will attack and destroy body tissues, then eventually the joints. This also causes the joints to rub together and causes more inflammation. Sometimes there's fluid that comes along with rheumatoid arthritis. The Arthritis Foundation Aquatic Program, or AFAP, is a community-based group program that uses a variety of water-based exercises to increase physical activity among adults with arthritis. Their objectives are to increase range of motion and decrease pain. Program details. The program has an audience of elderly population who are inactive due to aging and arthritis. Cost can range from $100 to $130 depending on class type, location, and instructor. If it's a specialty class, price will go up. The setting is community pool, although most YMCs offer AFAP programs. Size is up to 20 participants per one instructor, which is a good way for the elderly who are housebound, to socialize. Time is 1 hour, several times a week. Most people attend for up to 11 weeks, so like 6 to 11, whereas others continue as long as they can. Instructor certification. Candidates for AFAP instructors involves 8 to 12 weeks of advanced study, a minimum of 6 months practical experience. So most of the practical experience means that they need experience working with the elderly or something of that sort. They need to be CPR, AED certified, and they have to attend several in-person class workshops, which teach motivational skills, how to plan a program, what to do in case of emergencies, etc. The types of classes offered, there's 4 main types: circuit and interval. Circuit is something like high intensity interval training, which is 5 exercises, 30 seconds each, repeated 3 times. That's just an example. Resistance, the weights are usually foam due to the buoyancy, which makes it easier for people to lift. Cardio, and then specialty, which is where prices go up. So that's like aquatic kickboxing and noodling. So these are the reasons why aquatic programs are so good for people suffering with arthritis. It distracts from pain, there's muscle relaxation and stuff. My grandmother, who has severe rheumatoid arthritis, has been attending these programs for several years. She's experienced decreased joint pain, 20 pounds of weight loss, give or take, and improved mental state and better mobility. So those diagnosed with osteoarthritis and rheumatoid arthritis were placed in a study where some participants underwent aquatic exercise programs and others underwent an aerobic exercise program. They found that those in the aquatic group made the same, if not better, progress than the aerobic group. There were less recorded physical pains, and there was improvement in activity level and grip strength. So an example of an exercise that's performed in these programs is jumping jacks. It should be performed in standing level water with the water line just below the base of the neck. The participant should practice hip abduction and adduction, moving legs from the side to the sides and back to the midline. Arms are then added in the same way as the legs. They should not be raised above the water line, because if they're raised above the water line, this will be much more difficult to push down, putting strain on the joints. Arms and legs adduct and abduct at the same times. That is one full jumping jack, which can be repeated in increments. Jumping jacks are often used in stuff like HIIT or the cardio aspects. So to conclude, the Arthritis Foundation Aquatic Program, because it's scientifically proven to be effective for sufferers of arthritis, should be considered / recommended as a form of exercise for the elderly population. If they lack exercise, are losing joint mobility in large increments, need to lose weight, need socialization, and other reasons that go along with that. The only problem I see with this program is pricing, because obviously as one ages, they have other medical conditions that they need to pay for. So that's the only problem I see with the program. However, the prices will vary based on location. And that is it. Thank you.